All right. Good afternoon, Madam Chair and members of the committee. It has definitely been a long day. I should change my talking points to say good evening. I have a substitute for this bill, and I can speak to the substitute at the appropriate time.
Second. I'm so moved, Madam Chair. Sorry.
So it's been moved and properly seconded to adopt the substitute. All those in favor say aye. Aye. Any opposed? So that substitute is now properly before us. Delegate Tran.
Great. Thank you so much, Madam Chair. This substitute is a result of extensive dialogue between stakeholders, not just during this session, but I think we've seen various iterations of the bill to address autonomous practice for nurse practitioners over the last several sessions. The substitute amends the amount of time that a nurse practitioner must spend under full-time clinical supervision with a physician before they can practice autonomously from the current 5 years to 3 years. Regarding the patient care team that oversees the nurse practitioner's clinical supervision, the substitute maintains the existing patient care team led by a physician. So under current practice, physicians have to first establish a practice agreement with the nurse practitioner. If that physician cannot continue to oversee the practice agreement throughout those 3 years due to death or other unforeseen circumstances, then the nurse practitioner can notify the Board of Nursing that they've lost their collaborating physician. Then they are able to have about 60 days where they can work to find a replacement. After those 60 days, if another physician has not been identified, then the nurse practitioner has another 60 days to identify a supervising physician. So there's a 120-day period currently in the law. What our substitute and bill does is allows the board to approve another nurse practitioner to oversee the existing practice agreement if the proposed supervising nurse practitioner has over 3 years of autonomous practice experience and has routinely practiced in the same certification and with the same patient population. The substitute also includes an enactment clause that directs the Department of Health Professions to collect data on this bill's implementation, including the total number of applicants, the year of their initial licensure, their geographic area of practice, patient population, and the total number of disciplinary actions, if any, against nurse practitioners that are able to autonomously practice through the changes in this bill. I think that data collection is going to be really important and is of interest that I've learned from members of this committee, and also will help guide any additional policies in the future. There's also one technical edit to current law that we made at the request of the Department of Health Professions. I want to put kind of these changes in this proposal in the larger context of our healthcare professional shortage. As we've talked about throughout this session, Virginia and the country is experiencing critical healthcare workforce shortages that really affects the availability of care for patients throughout Virginia, whether they be new American communities, communities of color, or rural communities. 102 out of Virginia's 133 counties and cities meet federal criteria to be designated as health professional shortage areas for primary care. This is about 29% of our population lives in a critical shortage area. This bill can help us take those important steps to make sure that our communities have high quality care that they need. From 2019 to 2022, we lowered the required supervision timeframe for nurse practitioners, and during that time, there were no negative impacts on patient safety. This bill also brings us in line with other states. More than half of the states and the District of Columbia and the Veterans Administration have laws and regulations embracing nurse practitioners and allowing for some level of practice autonomy. All these states and areas with transition to practice requirements are at the 2 or 3 year level. So that really does help us get in line with the rest of most of the rest of the country. So I welcome your questions today.
Thank you. Are there any questions from the subcommittee? Seeing none, is there, let's see. If you could raise your hand if you are here to speak in support of this bill. Okay, and if you could raise your hand if you're here to speak in opposition to the bill. Okay, so we are going to set the timer for 10 minutes for each side, and that is 10 minutes total. So if you want to take a few seconds and organize, but we will be calling up those that wish to speak in favor of the legislation first.
I'm short like you, so yeah, I know. That's all right. Chairwoman Price and committee delegates, I'm Alicia Peck. I'm the president-elect of the Virginia Council of Nurse Practitioners. We are hope-filled that hopefully our persistence has paid off, but just on behalf of our organization, we wanted to thank Delegate Tran and Delegate Srinivasan for your support in advanced practice in nursing. To the MSB for taking forward steps to modernize Virginia legislation. To Mr. Grossman, his tireless efforts and prayers, he'll get some sleep soon. Virginia Hospital Association, Virginia Department of Health Professions, Virginia Nurses Association, American for Prosperities, AARP, the Governor's Office, our allied colleagues for your endurance in supporting our efforts to align Virginia's transition to practice requirements with the rest of the nation's states who require such laws. It's been our honor to work with you, and we look forward to our collaborative endeavors. Thank you for your support, and I ask your passing of House Bill 971.
Thank you. And if you all want to come up, if you're speaking in support, if you can all come up and line up now, and then that way you'll be right there. Thank you.
Hi there. I'm Ashley Apple, speaking on behalf of the Virginia Nurses Association and the 120,000 registered nurses in the Commonwealth, which of course includes advanced practice registered nurses. We just wanted to take this opportunity to thank Delegate Tran, bill patrons, and co-patrons for bringing this forward, for following the empirical evidence, for trusting advanced practice registered nurses to do what we were trained to do, and that is to provide high quality, equitable care to patients in the Commonwealth. We support this bill and we'll help you do the same. Thank you.
Thank you. Katie Page, I represent the Virginia affiliate of the American College of Nurse Midwives, and we appreciate Delegate Tran for bringing this bill forward and support our nurse practitioner colleagues. While we would hope that the bill would grant autonomous practice from the point of licensure, or at least provide parity for autonomous practice that certified nurse midwives enjoy, we're proud of the work that has been done thus far and hope you'll support this bill. Thank you.
Good evening, Madam Chair. Jared Calfee with AARP Virginia. We support the bill. This bill will increase access to much needed clinical care, and we thank the patron for bringing it forward and for all the work that went into it.
Clark Barano with the Medical Society. We have no opposition to the bill. We want to thank Delegate Tran for working with us. And the most important thing in conversations with Richard and Delegate Tran that we're going to do in the off-season is the Medical Society, the Nurse Association, and P Association, we're going to meet. We're going to talk early and often so that way we can fight in front of y'all a little less and come forward with things that improve healthcare for all here in the Commonwealth. We've been doing this for 5 years. I think a lot of y'all are happy that we don't have to do it again next year and hopefully for the foreseeable future as I make eye contact with Richard. So thank you again to Delegate Tran.
The Commonwealth thanks you.
Madam Chair, members of the subcommittee, Brent Rawlings, Virginia Hospital and Healthcare Association, and we're happy to weigh in and support this and really do appreciate the patron and all the folks that are working on this. A lot of productive dialogue makes everybody feel good, so thank you.
Awesome. Is there anyone here to speak in opposition? If you'll come forward. We will grant equal time, but you do not have to use all of it.
Hello, Madam Chairwoman, members of the subcommittee. My name is Lauren Webb, and I'm an emergency physician. Oh, can you not hear me? Hi, I'm Lauren Webb, and I'm an emergency physician. I'm here today on behalf of Virginia College of Emergency Physicians. We oppose any reduction in training hours for nurse practitioners to practice outside of their patient care teams. We believe we struck the right balance in 2018, requiring 9,000 hours of training in a specialty before practicing independently. Before I was able to practice as a doctor, I had no less than 12,000 to 20,000 hours of training in a supervised, rigorous residency program before I was able to practice independently. I and my physician colleagues will tell you that we needed every minute before we were comfortable providing care without supervision. We are most concerned for what this means in the emergency department. The ER is the safety net of the healthcare system, and when people turn there, they do so with the expectation that their clinicians have a deep knowledge, expertise, and training that will allow us to quickly diagnose, stabilize, and treat them. We urge you to keep the 5-year, 9,000-hour requirement for NPCC independent practice in the emergency department. Thank you.
Thank you. Delegate Tran, do you want the last word?
Sure, Madam Chair. I think a lot has been said about this bill, and I look forward to its passage today. And I think Clark from the MSV mentioned something that is also really important: is the commitment for continued dialogue. And I think that would benefit all patients across Virginia. So I'm excited about that as well, even though we can't put that in as an enactment clause.
Exactly. Glad we all understand that. I will come back to the subcommittee. Are there any questions or comments from the subcommittee?
Madam Chair,
Delegate Cole.
move to report as substituted.
Second.
It's been moved and properly seconded to report the substitute. Any conversation? All right, Madam Clerk, please open the rolls and members cast your votes. And that is recommended to be reported on a vote of 6-0. Thank you all. And we will now go to House Bill 978. Delegate Willett.
Thank you, Madam Chair, and it is good evening, members of the committee. I'm presenting HB 978. This legislation seeks to regulate Virginia's advanced practice registered nurses, APRNs as they're referred to, solely under the Virginia Board of Nursing, consistent with recommendations from a 2023 study by the Virginia Department of Health Professions, DHP. Currently, just as a reminder, the Board of Nursing regulations governing Virginia's APRNs require them to go through additional regulation by the Board of Medicine. Virginia is one of only 3 states that has that joint board structure. Regulation of the APRNs this way is different from the way the national APRN consensus model recommends, as well as different from what was recommended by the DHP studies that were done both under the Northam and Youngkin administrations, where they recommended that this APRNs come under just the Board of Nursing. You've actually heard some testimony already that I will also share in terms of some of the issues we're dealing with. And I will first say, Madam Chair, you're going to hear compelling testimony on both sides of this issue, and I encourage you to listen to both sides of the issue as I have done. I agree to carry this bill out of concerns about addressing health's workforce issues, just as Delegate Tran spoke to earlier. But I recognize that there are significant concerns about making any changes to the current board structure. So you really need to hear both sides on this. I do think that it's super important that we improve our ability to attract and retain nurses in Virginia, including the APRNs. And I think, again, numbers you've heard, one you may not have heard, is that we lose 40% of our nursing graduates from the 4-year programs actually end up hitting outside of Virginia. And so that's certainly a concern. This may be one way to address it, maybe not the only one, but at least one way. I mentioned those studies that were done, and we do have Erin Barrett from the Department of Health Professions who can speak more to those, and I'd love to have her share that with you.
Okay, give me 1 second. Are there any questions or concerns so far from the subcommittee? Okay, you can come on up. Thank you.
Good evening, Madam Chair, members of the subcommittee. Erin Barrett on behalf of the Department of Health Professions. The department was asked to study the issue of what it would take in terms of changes to Virginia's code to enter the APRN compact. The APRN compact does require that APRNs only be regulated by the Board of Nursing in their state. And as Delegate Willett mentioned, we, of course, have a different structure in Virginia. So that report reflected what was required to join the APRN compact. And I'm happy to answer any questions about how this operates in practical terms for the Department of Health Professions and APRNs.
Any questions? Delegate Tran?
Madam Chair, a question for our witness here. Can you let me know how many other states have joint boards in a similar structure to Virginia?
Madam Chair, Delegate Tran, I believe it is 3, counting Virginia.
Any other questions? Okay, if there's anyone here in the room here to testify in support of the legislation, if you'll all please come forward, and we will put 5 minutes on the clock. Go for it.
Good evening again. So I'm Ashley Apple, Virginia Nurses Association. I'm a nurse practitioner and a professor of nursing. 27 states and DC have full practice authority, which by definition means that they are regulated solely under the Board of Nursing, and there is independent practice. They're all doing just fine. There's no evidence that a joint board provides any benefit to the public. In fact, it actually may do harm. The Federal Trade Commission warns that when states allow regulatory oversight by physicians, they, quote, effectively give one group of healthcare professionals the ability to restrict access to the market by another competing group. And to be clear, the market in this case determines access to healthcare. The FTC calls it anti-competitive, citing the risk of physician bias due to professional and financial self-interest. These competitive costs should not be imposed on the public without compelling evidence of benefit to health, safety, or consumer protections, and in this case, there is none. There are 2.6 million Virginians living in a health professional shortage area, but we keep losing nurse practitioners when they graduate from school, because why would they stay here under the regulatory thumb of physicians and a long transition of practice period when they can scoot up to Maryland, who's had full practice authority for a decade, or DC, where full practice authority has been in place for 25 years, and they can practice starting independently from the time of licensure. So out of concern for public health, we ask you to help us make the practice environment better in Virginia so that we can keep more of our nurse practitioners and serve the needs of the public. Thank you.
Hey there, we've also met before, but again, my name is Alicia Pack. I'm the president-elect for Virginia Council of Nurse Practitioners. A couple of extra points here is the most important part of the role of nurse practitioner is the word nurse. The Board of Nursing, with the requisite expertise in nurse education, training, and practice, is the entity best suited to regulate NPs, which is the standard in 46 states and the District of Columbia. The opposition may say it's about discipline. It's not about discipline because 46 other Board of Nurses who have sole oversight have no problem with this issue. Be reassured, we are not going rogue. In fact, we plan to remain as a collaborative partner in patient health care indefinitely. We are, however, respectfully asking for an equal opportunity to be governed by the only body of professionals who are qualified and knowledgeable in the profession of advanced practice nursing. At a time where Virginia is struggling with access and affordability, we must be wise to make evidence-based decisions that reduce our regulatory burdens and enable our nursing workforce. Passing House Bill 978 is a common sense and cost-efficient legislation, and we ask for your support. Thank you for your time and consideration.
Katie Page, again, representing the advanced practice midwives. Again, I want to state importantly that this bill is not about an APRN compact. There's no language in this bill about joining a compact. This is about modernization and simplifying the regulatory structures for advanced practice nurses and advanced practice midwives, who currently are the only healthcare professionals in the Commonwealth that have no formal representation in regulatory matters or in disciplinary action by the boards that are promulgated to oversee their practice. The document that was a guidance document in 2016 called Collaboration in Team-Based Care that was produced by ACOG, as well as 16 other professional organizations representing APRNs, physician assistants, physicians, and midwives, stated that, quote, although authority for scope of practice determination and regulation resides with the states, professional healthcare associations have established and should continue to establish and promote standards of care and standards of conduct for their specific professions. States should rely on guidance by professional associations when licensing and regulating healthcare providers, end quote. The most appropriate professionals to establish standards for practice and regulations governing APRNs and advanced practice midwives, including disciplinary action, are APRNs, advanced practice midwives, and their professional organizations, not physicians and not medical associations. So I implore you to pass this bill, which again moves advanced practice nurses under the Board of Nursing and establishes an advisory board for advanced practice midwives. Thank you.
So we have about 45 seconds left.
Madam Chair, members of the subcommittee, my name is Josh Carlson. I come to you as a nurse practitioner as well as a veteran. That being said, I can speak to you about chain of command. In the military, nurse practitioners answer to their own chain of command. Doctors answer to their own chain of command. They all answer to the Surgeon General. So if there's a disciplinary intervention that needs to take place, they answer to their immediate chain of command. There's no crossover there. That happens, I mean, they operate that way in the Tidewater area, they operate that way in Fort Lee and Petersburg, they operate that way in Northern Virginia. So this is a common sense bill to pass. I ask that you support it similar to the way we do.
Madam Chair, Jared Calfee with AARP Virginia. I would just say that there's no scientific evidence that supports one clinical sector regulating another, and emphasize that this unnecessary bureaucracy can mitigate consumers' access to needed healthcare services that APRNs provide. Thank you.
Thank you. Is there anyone here to speak in opposition to the bill before we go online? Please come forward. You have 5 minutes.
Madam Chairman, members of the committee, I'm Scott Johnson, General Counsel for the Medical Society of Virginia. We are opposed to this legislation. I first want to thank Delegate Willett for the many times and hallway chats and meetings we've had with him to share our concerns on that. He's been very generous. And also, it's not a turf battle. Doctors love nurse practitioners, and I hope they love doctors back. If you remember nothing that I say, remember this. The agreement with Delegate Tran's bill that you just passed has the joint boards in there. What I've laid in front of you are 73 meetings that the joint boards have had since 2018. They largely handle the disciplinary process. Nobody has stood before you today to say the joint board process is broken. Nobody has told you today it's going to change workforce. Their job is to evaluate clinical decisions. Nurse practitioners and doctors diagnose, and so you want doctors and nurse practitioners making the decisions on that. They have one set of regulations to govern nurse practitioners. It's not duplicative. Also, another thing that I would ask you to remember is true, this bill before you does not have the word APRN compact in it. But as Ms. Barrett indicated, the purpose of the study that was done was to say if Virginia was going to join the nurse compact, the first step is getting rid of these joint boards, and then that bill is going to be next year's bill. So I would ask you to be consistent with Delegate Tran's bill, preserve the joint compact so we protect public safety, and I'm glad to answer any questions if you have them.
Good evening, Madam Chair. My name is Michelle Nadelka. I'm a physician. I'm a radiation oncologist practicing in Hampton Roads. I went to EVMS for medical school and VCU for my residency. Prior to my medical school career, my healthcare career began as a PA, formerly known as a physician assistant. Based on my experience in my practice, my education, and my clinical training, I stand in opposition to this legislation. This would dissolve the joint boards of medicine and nursing and consequently establish two separate and distinct paths of oversight and discipline for licensees practicing medicine in the Commonwealth. To be clear, NPs, PAs as I once was, and physicians all practice medicine, diagnosing and treating and prescribing things for patients. If the joint boards were dissolved, cases of patient harm or complaints from APRNs specifically would be heard and disciplined solely by the Board of Nursing. The Board of Nursing is only required to have 2 advanced practice registered nurses within its membership and is, by design, made up of a majority of members who are registered nurses and licensed practical nurses. These valued RNs and LPNs do not diagnose, prescribe, and treat patients within the scope of their license, and therefore should not adjudicate a case of misconduct for an APRN that is, in fact, practicing medicine. This would create disparate outcomes for patients and providers when it comes to patient protection. I ask that you maintain the joint boards and ensure that all practitioners in Virginia who practice medicine are held to the same standard. Thank you.
Thank you. And we'll go online. Karen Kelly, you have 1 minute.
Thank you, Madam Chair. I am a certified midwife and the president of the Virginia affiliate of the American College of Nurse Midwives. This is a necessary initiative to show the public the integrity of the regulatory process in our government. I bet many of you remember how hard the House worked in 2021 in the midst of a global pandemic and an ongoing maternal and perinatal health crisis to increase midwives in our state due to lack of licensure for certified midwives. That bill ultimately passed unanimously and went into effect July 2021. But currently it is February of 2024, and we still do not have a way to license CMs in Virginia. The regulations have taken over 2+ years to go into effect, in part due to a broken regulatory system with the joint boards. Overregulation that caters to special interest groups instead of standard-setting professional organizations stifles innovation by discouraging individuals to challenge established norms. I'd like to be clear that this work is the result of 3 different workforce studies, and that APMs and nurses do not practice medicine in practice or in regulation, and are not involved in physician disciplinary cases, so what they are asking for is discriminatory. Thank you.
Thank you, and I'll go to Delegate Cherry.
A question for the patron, maybe a couple questions, and you may need to phone a friend.
Phone a friend.
Which is absolutely fine. But I'm just trying to understand how the boards are made up now and what the boards would look like. So how many members are on the nurses board? They spoke to the fact that there would be 2 APRNs on the nursing board. How many are on there now? How many members are there on the board?
I'm going to ask Aaron to speak to that again. I'll get it wrong. Sorry.
Madam Chair, Delegate Cherry, there are currently, I believe there are 16 members of the Board of Nursing. It is one of our larger boards along with the Board of Medicine, which is an 18-member board. And there
That was question 2, so you've already gotten that one out of the way.
Okay.
I appreciate that.
Great.
Delegate Cherry.
And then the last one I had, are there advanced practice registered nurses on the Board of Medicine as it currently is constituted?
Madam Chair, Delegate Cherry, no, there are not.
So the doctors are overseeing the nurses, but the nurses aren't represented on that board that are overseeing them currently. Making sure I'm phrasing that right.
Madam Chair and Delegate Cherry, you are correct. There are no APRNs on the Board of Medicine.
Okay, thank you.
Any other questions from the committee? Delegate Srinivasan.
Sorry. Thank you, Madam Chair. I have a quick question for the patron. So how does the joint board work currently, Delegate? You have members from both boards, and they review both the licensing and the disciplinary. Did I get that right?
I can speak to that. Again, I'll have Aaron give you a little more detail on that. I think that would be better, Aaron, if you don't mind.
Madam Chair and Delegate Srinivasan, the Committee of the Joint Boards is actually not created in statute. It was created in regulation by the Boards of Medicine and Nursing for operational purposes so that they could delegate certain members of each board to sit on this one body. That body does cover disciplinary matters for APRNs and for licensed certified midwives, which can now be licensed, bless you. And the Joint Committee also, bless you, occasionally looks at regulations prior to it going to either the Board of Medicine and then the Board of Nursing to pass those regulations for APRNs. The actual licensing of APRNs is solely done by the Board of Nursing itself.
Thank you.
And
Madam Chair, I'm sorry.
Well, let's see if Delegate Willett, did you have any final comments?
Madam Chair, I just want to again thank everyone for their input on this bill. If I had met every APRN and every physician in my district before this bill, I certainly have. I certainly have now, and it's an amazing group of people, and we're blessed to have them. And I'd like to keep all of them in Enrico. But thank you so much for this dialogue.
Thank you, Delegate Srinivasan.
Thank you, Madam Chair. I want to say a few things on record. I've been very supportive of the Nurses Association and their causes. Right after I won the primary back in August last year, I met so many groups. I did a ton of research. And on my own, without even knowing Delegate Tran had brought a bill, I brought a bill. I entered a bill for 3 years. So it's very satisfying to me today that we all agree on 3 years. So I just want to say that on record. And I do thank the patron for carrying this bill. I recognize that I can see some overregulation that was brought up, and there are clearly opportunities to improve. We are one of the few select states, that's obviously a flag, clearly. I understand that there may be good reasons also for an independent board of nursing without the joint, setup that we have here. But I'm also thinking, Delegate Willett, that there are also some complex issues that we need to discuss and deliberate further. Because there are some really complex issues that needs to be sorted out and resolved. So if the patron is agreeable, I would like to make a motion to continue this to 2025 under Rule 22.
Second.
It's been moved and properly seconded for House Bill 978 to be carried over to 2025 session based off Rule 22. That is a voice vote. All those in favor say aye.
Aye.
Any opposed? That bill has been carried over. Thank you, Delegate Willett. You have another few bills in front of